Hello, I'm Lieutenant Keith Brady, and I am the Command Chaplain for Nuclear Power Training Unit Charleston. Today we're going to talk about a very important topic, a topic I wish I didn't have to mention, but it's something that really impacts our ranks, and that is the threat of suicide. One thing we always have to remember is that the mission is always important, but people are critical to the mission. And when we lose people through tragedy, it not only impacts the mission, but impacts families, commands, shipmates, and the fleet as a whole. Let's begin to talk about who's at risk. Well, truthfully, all of us could be at risk. But there are some people who are a particular target who, over time, we have found are the people that find themselves at risk. Well, the military is overwhelmingly populated by males, and when it comes to suicide, they are the majority, those who commit suicide. Ages between 15 and 34. And this may be possibly because most of the full rational capable ability is not really formed in men until after 25. Those who suffer from depression, feel like there is no hope. Those who are witnesses or have been previously exposed to suicide often find themselves as particularly vulnerable. Those who abuse alcohol or use other illicit drugs. Those who experience periods of rational thinking loss, where they do not think clearly. Those who lack a social support network, having close friends or loved ones or family near. Those who do not have significant others or spouses near them to remind them that they are loved and valued. Those who have an organized plan, who can tell you exactly how they will commit suicide and what they would do. And finally, those who suffer from a sickness or disease in which they feel there is no hope. If you find yourselves in either one of these categories, suicide could be a reality for you. But let's talk about threshold model risk. Who are the persons in these groups? And let's talk about it more individually. Let's talk about depression. About 75% of all suicides deal with depression. And how do we know that we are depressed? Well, changes in sleep patterns. When a person does not sleep, they lose their ability to think rationally. Changes in appetite. A loss of energy and motivation, particularly a loss of interest in fun activities. When we just don't feel like doing our hobbies and things that used to motivate us. Feelings of helplessness, hopelessness, and apathy, where we just don't care anymore. Deterioration of personal appearance. Deterioration of job performance and frequent somatic complaints or a preoccupation with death. These things can be warning signs that something is wrong and that we need to pay attention to ourselves. When we see these patterns together, one or any other, we should take them seriously. We should not fall into compassion fatigue. We should ask whether our shipmate is okay, or sometimes we should ask, are we okay? What are some causes of rational thinking loss? What brings us to the point where we are not thinking clearly? Well, lack of sleep. We know the schedule of those in the nuclear community is very grueling. Sometimes a lack of sleep can impair our thinking. Stress or anxiety about the present or the future can make us consider things that we normally would not do. Of course, drugs and alcohol is never a good thing to engage in abuse, and we know that alcohol is a depressant. So if we're feeling bad when we engage in alcohol, we are sure that we're going to feel worse. And actually, drugs is destructive at any level. Immaturity, and I highlight this to say immaturity is crucial. As I said, males under the age of 25, a part of their brain that controls reasoning and allows them to look at consequences is not fully formed. And so you already have that when they're sober. You already have that in place. So immaturity is something to be watched, something that we should consider. And psychosis or hallucinations. These are signs of rational thinking loss. But there's another factor that we should consider when we talk about threshold model risk is the lack of social support. Those who usually find themselves in suicide ideation are loners or newcomers. They don't have a lot of friends. They don't interact with people often. Loss of a significant other. Have you experienced the death of a loved one or a friend? Have you experienced a recent breakup of a relationship, of a marriage? These are things that should be monitored. Separation from family and friends, of which all of us in a military context could find ourselves at one time or another. Rejection by our peers. That rejection can be a perceived rejection because maybe we feel that we are not performing as well as we think we should in our studies, or rejection by peers for other reasons. When we live alone, we don't interact with others. We don't have people to engage. And finally, a perception that people don't care. If we feel that people don't care in our personal lives, with our friends or our family, or even in our command, even if these perceptions are completely untrue, perceptions are reality to an individual. The number one predictor of suicide is a person's perception of resources. Now, how does this all come together? Well, I like to summarize that in what I call the triad of danger. The triad of danger is a triangle in which we look at three elements. The first element is a stress or stressors that create hopelessness. And there are a lot of stress or stressors that can create hopelessness. Name a few that are so common. A suicide of a loved one, the death of a loved one, where one feels that grief has not been resolved. Loss of one's health, divorce, separation, parents' divorce, remarriage, loss of employment, loss of cherished possessions, retirement, where we fear the future as uncertain, financial problems, legal problems or arrests, victims of crime, sexual abuse, assault, witness to violence, poor grades or scores, substance abuse, physical abuse, sexuality concerns, and moral injury, a loss of one's moral, ethical values of faith. These are things that can make people feel hopeless. And when we have one or multiple of these issues, it is something that should be monitored. Then there is impairment. Someone is using alcohol and abusing it as a way to cope. Call it negative coping, or using drugs as a way to cope. They too can find themselves in a perilous situation. And finally, emotional isolation, where one does not have any friends or family or loved ones or a shipmate that they feel is close enough where they can tell about anything. One thing will not cause one to have suicide ideation or to commit suicide, but if we bring all these factors together, what I call the triad of danger, that can lead to a dangerous situation. So what do we do when we find that someone may be in this dangerous situation? Or what do we do if we find out that we are in a dangerous situation? What protective factors can we put in place? Well, first, we need to admit that we all need somebody. I know we live in a culture that sometimes it feels that seeking help is a sign of weakness, but in actuality, seeking help is a sign of strength. We need to allow some few trusted friends to be able to speak to us. We need to be able to have the courageous conversation, to go to people who may be in trouble and ask them, "Are you okay?" And ask that hard question, do you intend to kill yourself? The first part of caring is to ask. Ask that question. And then we need to take care of ourselves. It's not just enough to be tough. We need to be whole. We need to make sure that we are taking care of ourselves physically, mentally, emotionally, and yes, even spiritually. Are we eating like we should? Are we getting the adequate rest that we should? Are we hydrating? Are we taking the leave that we should? Are we fully practicing our faith traditions? These things can help us cope positively with the stressors of life. And finally, we need to make use of resources. You are not alone. There are resources that are here to help you. There is Embodied Mental Health, where the psychologists and the psych techs are there to assist. And then there is also Military Family Services. Fleet and Family Services have counseling available. But most importantly, your command chaplain is here for you. And chaplains are available to help you if you are suffering from suicide ideation or you feel like you're hopeless. Listen, I'm your command chaplain. I'm always available to talk to you. Chaplains have a gift that no one else has, and that we have the gift of absolute confidentiality. What you share with a Navy chaplain cannot be disclosed to the command, to your friends, or anyone else. It is absolutely protected. There's no need to carry a secret alone. A Navy chaplain is there to help you. So now, how do we get a hold of these resources? You can get a resources and get a hold of me by contacting me by my command cell at 843-364-1887. You can also email me at keith.braddy1@navy.mil. My office number is 843-794-3200. If in a chance you come to my office and you cannot reach me, there is also the Air Wide Duty Chaplain that is available 24 hours of the day in this region. And that number is 843-794-8400. And then you have the resources, the other resources of mental health, as well as military family life counselors. I hope this has helped you to realize that you have more help than what you think, and that life is not hopeless, and that we can together mitigate and hopefully prevent suicide among our ranks. Thank you.